Welcome, my dear friends. Myself is Professor Dr. Deshpande, and today is the 14th of April 2020, and we all are discussing regarding the coronavirus, that is a COVID, COVID. Do you know the full form? COVID, COVID, coronavirus disease. Coronavirus disease, that is COVID, COVID 19. It is invented in the, or it is detected in the 19th. Okay. So this is the coronavirus discussion part 2, which is based on the central government's pocket book regarding the coronavirus. We are at the slide number 27. We have completed this slide and we will go further. Slide number 28. How to conduct the community surveillance? As I have told you, surveillance is nothing but the survey with the close observation, very neat and decent observation, systemic observation. So this information can be obtained maybe directly from the patient regarding his history of illness, symptoms, or from the family members. If the patient is not able or is not in a condition to answer your questions, you can interrogate to the family members and get the detailed information about the present history of the illness. Then you can visit to his workplace. If I am working in the company, I can go, that means the warrior, nurse, or the social worker can visit to his offices, companies, schools, colleges, and take the information from the his what you can say, the professional mates or the colleagues, okay, school associates, and of course you can have the neighbors also. We can the neighbors or the people who knows that particular patient can also give the information regarding him, how many people he has visited till date, where he is always going, in which shop he is purchasing his all the things, and then we can proceed further to find out the different suspected patients or the contact patients from the this information that we have gathered with the surveillance. Okay, so this is the importance of surveillance. We can increase the network to diagnose the contact and suspected cases in earlier what you can say the phase, and that we can make a vilagikarana or isolation. Next, slide number 29. How to communicate during the community surveillance? It's a it's a social understanding of how to behave, etiquettes, mannerisms. So the first thing you should be, or we should be. I am also one of the part of these warriors. You can also the part of the warriors, maybe part of the warriors, soldiers. Although we are doing some good things for the society, we should always be polite, because you know that you, me, anyone can affect because of this COVID-19. So do not discriminate or do not discourage the patient or destroy the atmosphere. Oh my God, how you have went to that particular part, how you have purchased from this shop, why you go to the colleges, why you go to your company. No. Be cool and calm. Remember my words. So always sweet tongue and eyes on the head. This should be your policy. Sugar on your tongue, sugar on your tongue, and eyes on your head. Whatsoever the patient is always, patient's family members are always panic, are always anxious. They will be irritated. But you, as a warrior, as a nurse, as a social worker, we should be calm and cool. And tell the people that the government, we all people are like brothers and sisters, and we must help each other. This is a family responsibility. Like a nation is a family, whole world is like a family. That's why you understand that hydroxychloroquine, the tablets, when it is demanded from the 17 countries including America, Modi said, okay, if we have the enough stock, we will give you that particular tablet. So this is called as a world as a village. So here there is no separation, no geographical boundaries, no mind boundaries, no religious, no party boundaries, nothing. No is on a higher post, no is on a lower post. So no discrimination on the basis of your rank. So you should not say, sir, Deshpande sir is a HOD, head of the department. XYZ is the vice principal. No, no. Here everybody is at the same platform. We are the brothers and sisters, and that particular particular your attitude, feeling should reach to the mind of the people to whom you are doing the surveillance. That is something Dr. Deshpande is trying to explain you in addition to that particular pocket of the government. So this line, reading in between two lines, Dr. Deshpande is doing with this particular presentation. Okay. Now, but again, the important social distancing. Whenever you go, wherever you go, you keep a distance in between two people, minimum of 3 to 5 feet, minimum distance, because that is very much important. We as a soldier should also protect ourselves, and we also protect to another person who is in front of us. So that social distancing is a basic criteria, okay? Because that is a droplet infection. Remember this word. So avoid touching and the close physical contacts. So whenever you go for surveillance, always say namaste. Tai namaskar. I am Dr. Deshpande. Tai namaskar. Dada namaskar. See, this is the style. Dada namaskar. कसे आहात? बरे आहात ना? काळजी घेताय ना? थोडंसं आपल्याला माहिती पाहिजे होती. Keep a distance. Don't make a, oh, hello, how are you? Second. No. Shake hand, not allowed. Namaste, allowed. Shake hand, not allowed. Namaste, allowed. Social distancing. Better do not enter in his house, in his hut. Never enter in the working place. Ask the patient to come on the open air. Request him. दादा जरा बाहेर येता का, थोडंसं एक विचारायची होती, माहिती घ्यायची होती. Keep a distance and ask your questions. Don't enter into his kitchen, his what you call the sitting room. Sit on the kocha, sofa set, chair. Ask him the pain. Ask him the water drinking. No, nothing. You should not touch anywhere. Okay, that is also one of the care that one must take during the surveillance. Next, slide number 31. Interview. What will be our method? We will ask the questions and he is expected to answer. Otherwise also, sometimes the person, the society person, society people, they will ask you some their queries, difficulties, okay, and you have to answer those questions. So on both sides, for getting the information, you will ask the family members their name, gender, history of fever, cough, cold, body ache, sore throat, everything you will ask, visiting to different parts, foreign travel. But at the same time, they may ask you, डॉक्टर आम्हाला फार भीती वाटते, ते काय करायचं डॉक्टर, आम्हाला नाही ते कोरोना फार भीती वाटते आम्हाला. We are afraid. What to do, doctor? Please tell us. That will be request from their side. So you have to answer those questions as well. Then when you fill up the information on your own form, your own register, your handwriting should be very clear, because your senior officials, senior officers, senior administrative post, they are going to check all this information and they will feed the data in the computer. So who is the DTP operator, computer operator? He should understand what you have written. Otherwise, your visit will be useless. Your handwriting should be legitimate, readable. Then only an address, name, contact number should be very well, clearly written. Don't make too much hurry. Don't make a fast running. How many houses I have completed? I have to report to sir, I have to report to the madam. No, it is okay that you have to do it very fast, but that doesn't mean do it in a hurriedly and in a wrong manner. Do it very slowly and systematically, and that can be help a lot when we feed the information to the computer. Okay. Next, feedback. This is also important. For example, if I tell them, हे बघा मावशी, तुमच्या या दादांना काय खोकला बिकला आला तर मला परत बोलवा बरं का, इथे जवळचे आमचे ते ऑफिस आहे, तिथे येऊन सांगा तुम्हाला तुमच्या घरात कोणाला खोकला बिकला झाला तर. मावशी कळलं का मी काय बोललो ते? Have you understood, auntie, what I have said? Will you please repeat it? Yes, doctor, you said that if anybody, the seniors, my uncle has a cough, I should report to the family physician, I should report to the doctor, I should go to the corporation office. बरोबर आहे ना ते? Then you said, yes, correct. You have understood well. So you should confirm whatever you are telling, you should confirm with the next person that whether that person has understood it very well or not. तुम्ही त्यांना सांगितलं की आल्याचा चहा करून घ्या. If you ask them, do the gurgling with warm water. Always drink the warm water. Don't eat any ice cream. Although it is hot outside, don't do ice cream, eat the ice cream. Ask them whether they have understood the importance of that not eating ice cream, washing their hands frequently, whether they have understood it or not. That is called as a feedback. Okay. Next, we will go with the slide number 33, clarifications. I have already talked to you about it. Give them the authentic clarification. There will be 100 of questions. People will ask you a lot of things. Then you do the study of that particular pamphlet, whatever I am teaching right now, get the correct information and give them the right answers. Because they will ask, ते डॉक्टर असं म्हणतात की ते लसूण खाल्लं की म्हणाले आम्हाला होणार नाही कोरोना, लसूण नाने होणार नाही. People will ask you, if I eat the garlic, whether I will not get the corona. Don't tell anything wrong to them. Although you are Ayurvedic, although you are homeopathic, although you are naturopathic, don't make them confused. Don't tell them the wrong things which have not proved documentary. So you never say that eating garlic, eating dalchini, taking chyawanprash is a total protection from the coronavirus. No, this information is wrong. So don't provide any information wrong, because you tell them there is no alternative to wash your hands. There is no alternative to keep the social distancing. Okay, these are mandatory things that they must understand. Reporting any suspicious patient to the corporation, this is mandatory. All other things to improve your immunity, that are supportive, but it is not proved. Whatever, even our department, renowned, famous, and very popular department, Ayush, has suggested a lot of things to build up your immunity, to prevent. But does it 100% guarantee? No. Tell them very frankly. And by chance, if you do not know one question which he has asked, then say frankly, say, sir, I don't know the answer of this question. I will ask my senior authority, to my teacher, to my consultant, to my doctor, and I will come again tomorrow and I will answer your questions. Or I will phone you, you can give me your phone number. Remember these things. Don't make a wrong, what you can say, the notifications or wrong information to the people. That's why the government has banned to circulate anything regarding the corona through WhatsApp. Why they have banned? Because government officials, they know that some wrong information can create a havoc in the minds of the people. Okay, do you understand? Chicken khalyane coronaचा वाढ होते. Non-veg eating the chicken will make the problem with the corona. If you don't know, say frankly, I don't know exactly. I will ask my seniors and will phone you or will intimate you tomorrow. So whatever information is correct, which you have studied with this pocketbook, with the pamphlets of the government, WHO, that authentic information, learned information should be given to the public. Okay. Next, be prepared when you yourself visiting. Your own preparation is very much important. Always carry a sanitizer or some soap, paper soap. Carry your literature, format, pamphlets, which you can distribute to the people. Then you can have the writing material, for example, pen, your papers. Basically you should carry the mask, and you can carry the little bit extra mask. For example, the person you are visiting is having no mask, so donate that particular mask to him. Say, wear that mask and answer my question. Keep the social distancing. So be prepared yourself before visiting for any surveillance. Next, how to create a supportive environment. Cooperative environment is very important. If the people in front of you, family in front of you, society in front of you, their managers, if they are not cooperating, your whole surveillance will be in failure. They will not cooperate with you. They will oppose you. That's why first thing is involve influencer. For example, if I want to visit some society, what I should do first? I should search for the society office. I should search for the society chairman, co-chairman, and executive members. Then one of them, I should contact them. I tell them that tomorrow I am coming to your society to take the detailed information from each society members. I will visit to each flat, each bungalow, each house. Please ask your society members to cooperate me. As that society chairman is a leader of that society, they will hear his particular suggestion more than you, because you are something what is a third party. You are not a regular person that they know, they know. For example, I am living in Gokhale and I want to visit some of the chal houses. Gokhale houses are there. What I should do? I should visit, or I should try to visit corporator. In the municipal corporation area, there are always corporators. They have their social workers. So I should visit one of them and tell them, please meet me corporator. And I should request to the corporator. I can request Ganpati Mandal. There are the group of organizations who conduct the Ganpati festival. So I should visit to the president of that Ganesh Utsav Mandalaचे जे काही अध्यक्ष असतात त्यांना जाऊन भेटलं पाहिजे. So these people are called as influencers. They will cooperate you. And with these people, you can visit to each house. So Gram Panchayat is there, Sarpanch is there, religious leaders are there sometimes, teachers are there, company CEOs are there. So you should take the help of these people, okay? And then you can seek their support in awareness campaign. This surveillance is also called as a awareness, to become knowledgeable more and more about this infectious disease, pandemic, coronavirus. So this is the slide number 35. 36. Again, how to create a supportive environment. Plan community support for the high risk groups, because some sensitive areas are there because of religious, because of the community problems, and to tackle with these areas, slum areas are there, Jhopatpatty, poor people are there. They are already, what you can say, the very angry because of this lockdown hotspots. They have lost their day-to-day money, income. They have lost their income. So these people are very much irritated. Okay. So to tackle with these people, you must know these are the high-risk groups, or their contagious or contacts are more, suspicious people are more. So you must have the idea where I am visiting, in which area I am visiting, how is that area, how is the population of that area, how is the density over there, which people are living there, average people, slum people, illiterate are there, literate are there. So with this information, you can talk to them very efficiently. So identify the people, because there are some high risk people. For example, Dharavi Jhopatpatti. Have you heard about Mumbai, a capital, economical capital of India? Their slum area is there, Dharavi, and few patients have found out. Now this is very sensitive area. Then you have to identify this particular group and try to make preventive measures with this whole group of the Dharavi Jhopatpatti. Then another important thing regarding the children. If you find in some families, in some localities, there are children, so you must tackle this children problem in another way. Children problem is children problem about the health, children problem about the psychological, because of the locking system, curfews are there. So there may be some confusion in the mind of how to control the children problems. So there are separate groups how we can control the children problems. Develop community network. Community network. There should be some networking. As I have told you, society chairman, then our soldiers, warriors, what the government is called warriors, I call it as a soldier. Warrior and soldier, the same thing, nurses, and then there are medical officers, district officers. So this designation, hierarchy, they have the networking, and because of the networking only we can work efficiently. So we have to take who will be, which people will be called for emergency, which will shift the patient with the ambulance to the Naidu hospital in Pune, Sasun hospital in Pune. So these networking and division of the work should be there. Who are collecting the information, okay? Who are providing this information to the higher authorities? Who is taking the feedback or instructions from the higher authority? Then who is managing the local problems of the children and adults? If the patient is in isolation, quarantine, the different groups should be prepared, and that is called as a community network. So we should have the community network to coordinate all these activities. Next, how to create a supportive environment. Help household emergency contact list. Ensure each household has a current list of emergency contacts. As I have mentioned in the first part, that you ask the people to write down some phone numbers, write down some names to whom these people should contact when they suspect or when they have the contact with the corona patient or coronavirus infection patient. If somebody has started fever, cold, cough, to whom they should contact. Give them some pamphlet or information in written that you contact this person on this phone number at this time. And that's why we should have some networking. How to create a supportive environment. Raise your voice against the stigma and discrimination. Although some people are there common in some locality, don't disrespect that locality. Disregard those people. Just now I have given the example of, this is just for example. And Dharavi, there are some hotspots. So in any hotspot, if you find more people of corona infected are there, then all remaining people, they try to boycott. Remember the word boycott. Oh, no, this society should be banned. You remember first two people in the Pune, Maharashtra state, India. They came from some foreign countries and they came from Bombay to Pune on the Simhagad road, and then they found positive and they were admitted in the Naidu hospital in Pune, Maharashtra state. At that time, in the paper, there were news that the society people were very angry with with that particular couple. So that what I'm saying. Now, latest you have heard about some any religious type of one group was there, and they were having a lot of contacts, suspicious patients of corona, and that's why whole India were against that particular group. So this should not happen. We should not discriminate in the people. Huh? Everybody is brother and sister. So although they are infected, now we have all should have the brother and sister relationship, and we must try to cooperate them. That's why I'm not saying greet him. Quarantine is essential. Make isolation, make a separation, treat them, send them to the hospital. But that doesn't mean we should boycott their whole family, their relatives, their friends. No, nothing like that. That type of stigma or discrimination should not be there. Okay. Slide number 40. How to interact with the families. Greet with local salutation like namaskar. Namaskar is the best. Ram Ram. From a distance, Ram Ram. This is also the style to greet. Okay. Be respectful, polite, and empathetic. This word is very important. Empathetic. You should have the emotional binding with these people. All Indians, all the nationality peoples are my brothers and sisters. We are one family. We are one village. Globally, the village right now. So each and everybody should have this type of the emotional bonds. Then only we can fight with the corona. Remember my words. Okay. Then how to interact with families? Be aware that suspected and confirmed cases and their family members may be stressed and afraid. This word is very important. Always. Simple thing. When we feel ill, we are always upset with your mind also. Simply fever also, we get irritated. We shout to the family members, don't start TV. I'm getting bothered. Don't make any sound. So these irritation. Now here, this corona is making havoc in the world. Lot of people are dying, but that is not a rule. That is not a rule. That means if you are the corona, you will be die 100%. That is not a rule. Remember. But the people are fear in their mind. Even simple sore throat, simple nominal casual. One time I then I get shocked. Oh my God, this is little cough. Tomorrow I may have the sore throat. Third day I may have the fever, and then I will have to go to the Naidu hospital in Pune, Maharashtra state, for the isolation, quarantine. Oh my God, what my family will do? What will happen with them? What will happen with my mother? What will happen with my wife? What will happen with my son? All these imaginary questions are coming into your mind, and then the person starts what you can say the neurosis. there is one common problem, cardiac neurosis. Now the people are suffering from corona neurosis. Neurosis, I compare it as a benign tumor of the mind. This is new thing. Psychosis is a malignant condition of the mind. So neurosis is a psychological, we can treat at our level, warrior level, doctor's level, because this is just phobia and fear. That's why we have to listen the people very carefully. This is not one-way traffic like me at the moment talking. I know I am talking, this is a one-sided dialogue. I know. I have stopped your mics. That is just because to control my timings. Sorry for that matter. But it doesn't mean that you should stop the people. You should stop. You should not stop the people. Please stop your mics as well as please stop your what you can say the videos. Okay. Now next slide, slide number 42. Okay. So gather the accurate information from the person. Hmm? That is the name, date of birth, travel history, list of symptoms. Huh? So everything should be very clear cut written in our these things. Okay. Name, date of birth, travel history, and list of symptoms like fever, cough, and difficulty in breathing. Slide number 43. As I have told you, how to interact with the families. You may not have an answer for every question. Remember, there may be some tough questions, maybe regarding the biochemistry or vaccination or how many people are there in Pune. So a lot of things the people will ask you. If you don't know exact number of the people admitted in the Naidu hospital, tell them frankly, I don't know right now. I will inquire and I will let you know. Okay, so this should be the correct answer. How to interact with the families? Share information and pamphlets or handouts. This is very important. Handouts. You must carry some information booklets and the pamphlets. That is very important. Okay. And discuss their questions with the help of these particular pamphlets. Next. What are the safe practices at home? This is the next point. At home, if there is a suspicious patient, if there's a quarantine patient, even normally also stay away from each other. Stay in a specific room and away from other people in your home whenever you are quarantined. Maintain distance of at least 1 meter. Restrict all the movement so that others in the house stay safe from the infection. So if you are infected or one person is infected from the family, he should be quarantined in a separate room. Isolation should be separate. Isolation in a way, there should be separate bathroom as well. If possible, give him the separate bathroom. Next, slide number 46. What are the safe practices at home? If suffering from fever, cough, or having difficulty in breathing, wear a mask. This is very important to protect the others. If you are having the cold, cough, like flu symptoms, always wear the mask. Remember these things and protect the other people. So, what are the safe practices at home? Wear the mask when you are around with the people. Whenever you enter the sick person's room, you should wear the mask. Safe practices at home. Avoid going to the public places unless and until it is an emergency. If you are a police people, if you are administrative people, if you are doctor, paramedical staff, laboratory staff, then with the permission of the higher authorities, only you should go out of your home. Do not go to the work, school or public areas. If you are infected, you could transmit infection to the others. So very precautionary when you are yourself is an ill person. Avoid visitors or supporter staff coming to your house. If you yourself is suffering from flu-like symptoms, cold, cough, fever, sore throat, body ache, then don't ask to come maid or drivers, etc. These people to come to your house. Remember this thing because they are supportive staff, although they are what you can say your servants. Here, what again and again I repeat, everybody of us is brother and sister. So take care of the health of these servants as well. That is the most important part when you are at home and suffering from cold, cough, fever. Support. Assign family member to take care of the bedridden person. If there is a bedridden person, there should be only one person who can take care of this bedridden person, maybe old person with diabetes, heart disease, hypertension, bronchitis, COPD, emphysema, bronchiectasis, respiratory diseases. So, but caretaker should be only one person from family member. Like Monday, कोणीतरी वेगळंच, one person, Tuesday another person. So this should not happen. One patient at home and one caretaker. Only this type of the coordination should be there in your home. One patient and one only caretaker and one fixed caretaker. Next, always monitor the symptoms. Every day you should look whether the symptoms are increasing or decreasing, fever is coming down or high fever. And then if whenever there is a breathing difficulty, that is the most important sign I can say, where you should admit the patient immediately with high fever. Minor cough here and there, don't worry about it. But whenever the person is suffering severe fever, high fever, above 101 degrees Fahrenheit, severe breathlessness, admit the patient. Next, slide number 52. Protective hygiene. Avoid the sharing of household items. You should not share with that person who is suffering from cold, cough, flu. There, all the eating plates and drinking material should be separate. His towels, beddings, everything should be separate. Then throw away the used linen clothes in a trash can. And then wash and disinfect linen in warm water and soap. Warm water and soap for washing purpose. Tell the household people, family members, caretaker, you must give all this information to them. And for dry in the sun, sun is very important for disinfection process. Okay, so soap and water use liberally. Next, 53. Here again, linen can be soaked in the hot water and soap in a large drum. Then avoid splashing. Sometimes when you wash and pour that bucket into the drum, some splash of the liquid or the material is coming out. That should be avoided because that can touch the person who is doing that particular job and he may get infected. His eyes, nose, flash will come to his hair. Then place all the used tissues, disposable gloves, face mask and other contaminated items in a container, but closed container, lid, having the lid container, and inside there should be plastic bag, yellow plastic bag or something like that. Then high touch surfaces, you must remember, coronavirus, this particular can stick up to the different places for a longer time, 8 hours, 12 hours, 24 hours. So whenever you are moving around, you must disinfect all these things, tabletops, okay, door knobs, bathroom fixture, toilets, phones, keyboards, computer, tablets, bedside tables, everything should be sterile each and every time, washing with the sterilization, and especially area, if there is a blood, stool or body fluid, that should be utmost care should be taken for that matter. Utmost care, remember. Write down this slide number. We will continue from the slide number 5, 6 because it's the last 3-4 minutes. Wash your hands minimum for 20, 30, 40 seconds. Okay, minimum for 20, 30, 40 seconds. You can use the sanitizer with 70% alcohol based sanitizer. And when to wash? After touching the high touch surfaces. High touch surfaces. I have just now mentioned all the material that you are using. Okay. Then wash hand often, every time. Although it is a tiresome, boresome, you do it because that is the only way to prevent the corona infection. Okay. Next. Keep away from elderly. This is the most important. Take care of elderly. Today also, our Prime Minister Modi ji said in his 7-step program, please do take care of the senior citizens above 60. Especially if they are already having some illnesses like the heart problems, then respiratory problems like asthma is there, hypertension is there, paralysis is there. So you should take the utmost care with these people. These people should be kept in another room, separate room and separate bathroom. If at all possible, try to do that. Avoid sharing household items, that we have already seen, that person suffering from cold, cough, fever, body ache, suspected person, diagnosed person, isolated patient, other family members should not share their these dishes, drinking cups, tea, towels, beddings. No sharing, no share business. Okay. Then wear a triple layered mask. This is very important. Triple layered. Then disposable mask should never be used. Never. Today, our Prime Minister Modi ji said even you can do household mask, house prepared. Modi ji said, don't forget about N90 or something, and never go for standardized mask and this thing. Clean handkerchief, but it should be very tightly knotted and carefully. You should learn the technique how to make the mask, okay, and how to put it correctly and how to remove it correctly. So only less than 1 minute has left. So we will continue with the slide 60 and then we will stop. If symptoms appear, fever, cough, difficulty in breathing, it should be immediately informed to the nearmost family physician, corporation medical center like Naidu Hospital, Sassoon Hospital, family physician, and then you can have the phone numbers of these people. So in any emergency, you can use all these phone numbers. So my dear friends, I think we have here at the slide number 60, and I kindly request please continue joining at 4 p.m. today, that is on 14th of April 2020. Thank you very much for your nice cooperation, and please continue this type of support for all of my lectures. Tomorrow there will be lecture on the research and maybe lectures on medicine and Ayurvedic physiology. We will continue Corona maybe day after tomorrow. Okay. So thank you very much, and please do take care of yourself. Henceforth, most of the